Hi, my name is Maggie Williams, and I'm going to be doing my presentation on ACL tears. The anterior cruciate ligament, or ACL, is one of the four ligaments responsible for stabilizing the knee, and it also prevents the tibia from shifting anteriorly of the femur. When the ACL is torn, the knee loses stability. This can lead to prolonged pain, weakness, and buckling of the knee when walking or going up and down stairs. ACL tears are prevalent in young athletes, especially females, so being able to recognize a possible ACL tear is vital when working with athletes. I used to be a student athletic trainer when I was in high school, so I've witnessed quite a few ACL tears, especially when working in football and basketball. Our head athletic trainer would show us how she knew it was an ACL tear and how she was able to recognize it. It's really what got me interested in all of this, so I'm excited to get to talk about it. ACL tears are most common in athletes, especially in sports such as soccer, basketball, and football. Tears occur from sudden stops or changes in direction and jumping and landing. That is why it's really prevalent in those kind of sports. This is why it's important for athletes to have a proper training program to strengthen and stabilize the knee joint. As a physical therapist assistant, I work with lots of athletes who have had ACL reconstructions because they tore it playing football or basketball. So I have lots of experience dealing with these types of injuries. The ACL can also be torn in other ways, other than just sports, such as work injuries or automobile accidents. These are less common, but they are possible when the muscles surrounding the knee joint are weak. I even had one patient who tore his ACL because his dog ran into his knee. So freak accidents can happen every day. Signs and symptoms. Typically, the first sign of an ACL tear is going to be hearing and feeling a loud pop. This pop is going to be accompanied by immediate swelling and severe pain. Since the ACL is torn, the stability of the knee is gone, so there will be a feeling of giving way or buckling when standing on it. People with a torn ACL will probably also have a hard time getting the full flexion and extension range of motion in their knee, and this is because of the increased swelling in their knee. There's not enough room inside the knee to be able to go through that full range of motion with all the swelling. Tear severity. So there's three different types of tears. Grade 1 tears are mild damage to the ACL. The ACL is mildly stretched, but still provides adequate stability to the knee joint. This does not require surgery to fix. It can be rehabbed with some physical therapy and bracing. A grade 2 tear is when the ACL is stretched and partially torn. I put rare beside this because you really never see a grade 2 ACL tear. Usually ACL tears are all or nothing, so managing to only tear it partially is a rare occurrence. And then a grade 3 tear is when the ACL is torn completely in half and provides no stability to the knee joint, and this has to be taken care of with surgery. Injury prevention. Exercise is so important for preventing ACL tears. Athletes especially should have training programs specific to improving lower extremity stability for their sport. If their sport has a high risk of injury, those kind of exercises can include like strengthening the hip, knee, and ankle. That's lower extremity. Emphasizing proper technique for jumping and cutting, agility exercises focused on pivoting, cutting, quick stop. All those things are what cause ACL injuries in the first place. So training that way, getting the joint used to doing those kinds of things, and getting the ACL used to taking that kind of toll is going to be best for preventing it because it'll be built up and stable. ACL injuries occur more predominantly in females due to women having a higher Q angle. If you don't know what a Q angle is, it's basically the angle of the imaginary line that goes from the anterior superior iliac spine in the hip to the center of the patella. Women have wider hips for childbirthing purposes, and so that wider angle puts the knees in a more compromised position, which makes them more prevalent to knee injuries, including ACLs. Diagnosis. An ACL tear has to be diagnosed by a physician, but athletic trainers are trained in doing Lockman tests. I know how to do a Lockman test, and I provided a video if anybody wants to watch it. But basically, a Lockman test is performed when the athlete is laying down and their leg is completely relaxed. And the examiner, whoever is examining, will use one hand to stabilize the thigh and their other hand to slightly bend the knee about 30-ish degrees and give a little bit of like a pull on the tibia. And it should feel firm. That's the infeel you would expect. But if it's super mobile and lax and gives a lot, then that's evident of an ACL tear. And then at that point, I would recommend that that person go to the doctor to get diagnosed and get scans to verify. Scans that would verify a diagnosis of ACL. MRI is the most common scan used by doctors. Ultrasound can also be used, but it's not common. MRIs are the best scan because they can detect hard and soft tissues in the body. X-rays cannot detect ACL tears, but sometimes doctors will get an X-ray just in case they missed any kind of bone fractures or anything like that. But that cannot be used to diagnose ACL tears. MRIs is the way to go for that one. Injury treatment and management. Treatment is based on many different factors, such as the patient's age, type of injury to the ligament, and sport or activity goals. Grade 1 tears can be treated non-surgically with bracing and physical therapy. So basically, you would just be non-weight bearing for a while, and then also doing exercises and physical therapy to improve the strength and stability of the knee. Surgical intervention may be necessary for patients with a grade 3 tear, and then after that, post-op care would be taken care of in physical therapy to rehab that knee and get it back to previous level of function. So I decided to include the post-op care for if you were to get your grade 3 tear repaired. So there's 3 phases. This one is phase 1. Every doctor is different with their specific protocols, but this is just generalized based on my experience. So usually in phase 1 is about 2 weeks, and there's not really much you can do in the first couple of weeks because you just had major surgery. So the focus is mainly of reducing your pain and swelling, getting some quad control, waking that muscle back up, and then achieving full knee extension, because knee extension is vital for getting full heel strike with the gait. So if you don't have full knee extension, you're not going to walk right. Patients usually start with crutches, 2 crutches, weight bearing is tolerated, and then you would progress that per the physical therapist. So as the patient's leg gets stronger and they feel more comfortable walking on it, they can progress from 2 crutches to 1 and then to no crutches at all. Every doctor is different as far as bracing goes. You'll always start with a brace, obviously, but every doctor is different with some of them like it like a certain degree of flexion on the adjustment of the brace, and then locked in extension when walking. And typically that's how I've seen it. Focusing a lot on mobility and light strength. So heel slides, gastroc stretch, hamstring stretch, and then strengthening is really limited to like isometrics and stuff laying down on the table. And then straight leg raises, I like to keep the brace locked in extension because the quads are not strong enough to be able to do that on their own. So the brace really helps with that. And then gait training with crutches. So a lot of times patients will come into the clinic and their crutches are either too tall or too short and they're not using them correctly. And so they'll come in on day 1 and we'll get those adjusted and teach them how to properly use those crutches. Post-op phase 2 is about the 2 to 6 week mark. During this time, you want to get full range of motion because usually 6 to 8 weeks is when you're fully healed, and you don't want to be fully healed without full range of motion because then it's a lot harder to get it after you're healed. So during this 2 to 6 weeks, full range of motion is so important. So we'll continue with those mobility exercises and stuff and a lot of passive range of motion. You're able to progress strength during this time. Move on to standing activities such as heel raises and mini squats and step ups. Usually step ups are like a 2 or 4 inch step. and progressing up from there. Cone walking to help with gait pattern, and normalizing the gait pattern without crutches at this point is important, and trying to get back into everyday life stuff, ADLs, activities of daily living. And then phase 3 is kind of the wrap up. 6 weeks to 3 months is what I put, but really it's anything after 6 weeks because every patient is different as far as when they're able to go back to their sport or work for whatever they do. But that is the goal for this phase of rehab, is to return to that sport or work. No brace anymore at this point, should be well strong enough to go without a brace. Full range of motion should have already been achieved. Now we can move into more dynamic strengthening stuff like lunges, deep squats, a lot of dynamic balance and agilities, just things to kind of wean back into that sport related stuff. And then the patient will be cleared to return to work or sport per their doctor, because physical therapists cannot clear them. Their doctor has to clear them. All right, and then so to wrap it up, I'll kind of refresh on some of the things I mentioned earlier. The ACL is one of the 4 very important ligaments in the knee that provides stabilization. That is why it is so important to take every precaution to prevent injuring it. ACL tears occur most often in sports, especially in females. Coaches and athletic trainers should make sure that their athletes have the appropriate fitness programs that will strengthen the structures around the knees. And those programs should include sport-specific agility drills, emphasis on technique, and general lower extremity strength. And then these are my references. Thank you so much.